Good afternoon, everyone, and welcome to today's webinar. We're having a discussion on the Center for Migration Studies' new report, The Crisis Survey, the Catholic Church's work with immigrants in the United States in a period of crisis. My name is Emma Winters, and I'm the Communications Manager at the Center for Migration Studies. This panel is going to last around an hour, and we will record it, and we will share the recording with all the registrants after the event. Without further ado, I'm going to turn it over to CMS's Director of Programs, Daniela Alulema.
Thank you so much, Emma, and good afternoon or good morning to everyone. And on behalf of the Center for Migration Studies, I welcome you all to today's webinar. During today's session, we will be presenting the findings and recommendations from a recent survey of Catholic agencies that work with and for immigrant and refugee communities in the United States. And we have a distinguished panel joining us today. We will hear from Donald Kerwin, who is Executive Director of the Center for Migration Studies and lead author of the report. We also are delighted to be joined by Alfonso Lara, who is the Director of Centro San Juan Diego, a ministry of the Archdiocese of Denver. He is passionate about educating the Hispanic immigrant community to thrive in their personal, spiritual, and professional lives. We also will be joined by Monica Ruiz-Caraballo, who is the Executive Director of Casa San Jose in Pittsburgh. Monica is a powerful advocate for Latinos on legal, housing, development, and educational issues. Monica is having some technical difficulties, but hopefully she'll be joining the panel very soon. Both Alfonso and Monica will share with us some reflections as representatives from organizations that work on the front lines with immigrants. And to start us off, I wanted to share some background information about CMS's work with the Catholic community and also some of the key findings from the survey. CMS launched its Catholic Immigrant Integration Initiative in 2013 to examine the work of Catholic organizations with immigrants. And the initiative looks at the work of parishes, universities, schools, service providers, charities, hospitals, and it documents and disseminates best practices and model programs on immigrant integration. And our goal with this initiative is to support, expand, and strengthen the work of Catholic organizations so that we can work together, learn from each other, and also build our collective capacity to serve, accompany, and empower immigrants. And as part of this initiative, CMS has conducted surveys on the services, challenges, and successes of Catholic organizations that work with immigrants. And today we will be presenting the fourth and most recent survey that looks at the work of Catholic organizations during the Trump administration and the COVID-19 pandemic. And if you haven't read it yet, my colleague Emma will drop the link to the report in the chat box, so you can check it out. Just a brief note on methodology. We conducted the survey between December 2020 and February 2021. And we received 189 valid responses from a diverse cross-section of Catholic organizations, including parishes, congregations, diocesan offices, colleges, ministries, religious orders. And the responses came for the most part from traditional immigrant destination states. This, of course, by no means is a representative sample of the universe of Catholic organizations, but the responses do give us some insights into the challenges and obstacles that immigrants faced during the Trump administration and the pandemic, as well as the challenges that Catholic organizations that serve them face during this time. The report also documents how nimble and vital Catholic organizations are in their services to immigrants. So I briefly want to mention three main findings that we drew from the survey. First, Catholic organizations, not surprisingly, saw an increase in the demand for services during the pandemic, which led them to add new services to meet the needs in their communities. For Catholic organizations, these services included the delivery of food and PPE, financial assistance, COVID-19 testing and contact tracing, mental health services, and others. Universities reported offering new services to their immigrant students, such as emergency grants and pastoral and grief support. Parishes also mentioned providing supported funds to affected families, assistance with funeral expenses, gift cards for food and gas, and rental assistance. Our second finding is that pretty much every respondent said that they started providing services remotely during the pandemic. Some of these services included faith formation education, legal counseling, ESL and citizenship classes, rosaries and novenas for those who lost loved ones. However, our respondents also spoke about the impact of the digital divide that exists between immigrants and US-born residents. Respondents spoke about their clients not having a reliable internet connection or lacking access or understanding of technology and online platforms. Others also spoke about how virtual classes were challenging for immigrant students, especially those who live in multi-generational households with no private space for proper online learning, or those who have to juggle multiple responsibilities between school, work, and family. Our third finding is that an overwhelming majority of respondents stated that immigration enforcement affects immigrants' participation in their services and programs. Some of our respondents share that fear keeps clients from seeking services. Others talked about how immigration enforcement has created trauma, particularly in families who were separated due to detention or deportation. Also, others spoke about fear of arrest when driving, which keeps immigrants from attending mass or participating in parish life. Healthcare institutions who responded to the survey also mentioned that undocumented immigrants either avoided or delayed visits to the doctor due to fear of deportation or due to the expanded public charge rule that the Trump administration implemented. So with that, let me pause right here and pass it on to the lead author of the report and Executive Director of CMS, Don Kerwin, who will continue the presentation.
Thank you, Daniela. As you all know, CMS is a think tank and an educational institute on international migration. It was founded by the Scalabrini congregation 57 years ago. So that's a long time. We work with a range of actors in the immigration field, but we try to be particularly supportive of Catholic institutions and of faith leaders of all kinds in their work with immigrants. We're trying to support and expand the community of people who care about immigrants, who care about facts, and care about human dignity, the values that underlie this work for us. Our recommendations fall into 6 general baskets. One is immigration reform. The second is COVID-19, post-COVID-19 services. The third is collaboration. Fourth is modeling inclusion by Catholic institutions. The fifth is Catholics who aren't with us on these issues. And the sixth is additional research. On immigration reform, in our past surveys of Catholic institutions, respondents viewed US immigration policies as a social problem, but also a significant barrier to their pastoral work with immigrants. They reported that US policies divided families, diminished parish communities, reduced attendance at Mass, and reduced participation in various ministries and programs. The previous administration, let's face it, did its level best to dismantle most of the immigration and refugee programs that the Catholic community cares about: family-based immigration, asylum, refugee protection, and various humanitarian programs. As with our past survey, crisis survey respondents reported on immigrants who feared that they could be arrested, detained, and deported if they came forward for assistance from Catholic institutions. In response, we recommend that these institutions redouble their work for reform of US immigration policies and laws. And we particularly endorse the US Citizenship Act of 2021, which you can read about in the report and elsewhere. Second, post-COVID-19. The survey identifies the obstacles encountered by immigrants in accessing Catholic programs and ministries. And of course, the pandemic itself was one of those obstacles, a main one. It also shows the reach, as Daniela mentioned, the reach and the vitality and the relevance of Catholic institutions to the protection and well-being of immigrant communities during what's been an unprecedented public health crisis. During the pandemic, survey respondents added significant new services, as Daniela indicated. Given the work of Catholic institutions in responding to COVID-19 and the high esteem that they're held in immigrant communities, we think that they can and should play an important role in encouraging immigrants to get vaccinated and in advocating for equal benefits and services to immigrants on a federal level and on a state and local level as they seek to recover from the effects of the pandemic. Catholic institutions should also take stock and build on the creative new program skills and capacities that they've developed in serving immigrants during the pandemic. And they should develop plans to ensure that immigrants can access their programs and ministries, including the remote programs, moving forward. These plans need to combine communication strategies. They'll need to include federal financial support in some cases, and services such as transportation, childcare, and training on the use of communications technologies. In terms of collaboration among Catholic institutions, past CMS surveys have lifted up synergies between diverse agencies. Catholic parishes, for example, provide legal, refugee resettlement, health, and educational services to a higher degree than we'd imagined before. Of course, Catholic charities agencies and national Catholic trade agencies address the same overarching needs, but from different vantage points. It would strengthen the work of the Catholic Church with immigrants to map and to improve the programmatic connections between Catholic institutions, particularly those that are responding to the same needs. Modeling inclusion. I think if Catholic institutions are to serve as mediating institutions that help immigrants integrate into the larger society, they need to model immigrant inclusion and immigrant leadership themselves. We found that our parish respondents did that for the most part, but most other respondents reported on disparities between the rates of immigrant leadership in their institutions and immigrants who use their services. Lots of immigrants using their services, very few immigrants among the leadership. Having staff and leadership that share the same language and cultural backgrounds as those with whom they work and worship obviously facilitates outreach and service delivery to those communities. Our fellow Catholics, our prior surveys have reported that social hostility and nativist rhetoric interfered with the ability of Catholic institutions to fulfill really a core aspect of their mission and their discipleship, which is to welcome the stranger. Many Catholics in public life, sectors of the Catholic media, and individual Catholics harbor beliefs and attitudes about immigrants that are inconsistent with Catholic social teaching and the policy positions of the Church. Some treat migrant and refugee protection as a secondary issue. That's a viewpoint that Pope Francis has called understandable for a politician looking for votes, but not for a Christian. This dynamic has been a major source of consternation for participants in our Catholic Immigrant Integration Initiative and for Catholic immigrant serving institutions. Catholic institutions should develop a comprehensive strategy to engage Catholics who do not understand, who ignore, or who work at cross purposes to Catholic teaching and policy positions in this area. It's a big problem at this point. And then finally, researchers always recommend, their last recommendation is always more research. And so I'm going to do the same thing here. We recommend that scholars and researchers prioritize independent, person-centered research that critically analyzes the work of Catholic immigrant serving and immigrant advocacy and organizing institutions. There's a growing body of research that centers the perspectives of immigrants and refugees regarding government policies and practices that affect them. And a lot of this research has taken place through Catholic institutions. We see the need for more research that assesses the work of Catholic and other faith-based institutions from the perspectives of immigrants and refugees. Such research might explore the work of Catholic institutions in promoting racial justice, for example. It might also explore difficulties raised in our survey around connecting immigrants to disability services And what we heard was a stigma for some immigrants in receiving mental health services. Let me stop there and turn it back to Daniela, and just to thank all of you for joining us today.
Thank you so much, Don. And as I mentioned earlier, to have reflections and testimonies from groups that are on the ground and that are described in this report, we have invited Monica and Alfonso to join us today so that they can share a little bit about their work, their ministries, and the realities that they're seeing from their vantage point. So welcome to both of you, Alfonso and Monica. Thank you for joining us again. And I want to start by just asking you to describe some of your work in your ministry and in your organization with immigrants. So I'll begin with Monica first.
And my dog just started barking. But anyway, thank you for having me. Yes, hold on a second.
It's okay. We can go with Alfonso if you prefer. All right, Alfonso.
Thank you for the opportunity, Daniela, and Monica. Thank you also for giving me a chance to speak first. What I can tell you, Centro San Juan Diego is a ministry of the Archdiocese of Denver. We try to promote the common good of the Hispanic community through education, through family support, promoting always integration, and trying to develop leadership and leadership formation, basically. What we do when we talk about education is basically help people to improve their skills and their employability. But not only that, we try to offer classes of GED classes, preparation classes, so they can go to a specific agency and get present their GED test and acquire a GED. We offer ESL classes. We offer citizenship preparation classes for those that qualify. We have several literacy programs like the financial literacy program, computer literacy program at different levels. We also have a program for individuals that would like to become certified tax preparers, and that's through AARP and also the IRS. It's a beautiful program. We have other programs that are more family-oriented programs like the Creados para Amar, a domestic violence education and prevention program. We have programs that promote effective communication between teens and parents that are called Familias Virtuosas, and another one, Familias Fuertes. We have a Diálogo Entre Mamás program for women that are in the house and try to get some mental help and support among themselves. We have legal clinics. We offer a lot of referrals and support, referrals to emergency support individuals. What we try to do, another important aspect that we have, is we try to form people on the Catholic doctrine as well. So we try to help them to integrate fully into society and also into the ministry of the church. And that's kind of the approach that we have here at Centro.
Excellent. Thank you, Alfonso, for sharing that. And let's turn it over to Monica.
Thank you. Monica Ruiz, the Executive Director of Casa San Jose. Casa San Jose was actually given life by the Sisters of St. Joseph. Sister Janice Vanderneck, who is our founding director, had a vision, and she saw very early on the needs of the recent arrived immigrants here in Pittsburgh, where the Latino population is about 2%. So for a major city, it's fairly small. And so she had a dream. And, the dream was that we would have something to help these folks as they recently arrived. We took that, and not only do we have the majority of the staff that we have are immigrants, but we also have 2 former clients of ours on our board to help direct the work that we do there. We provide a lot of direct services, a lot of social services, anything that you can think of, really. We have youth programming, adult programming. We have ESL classes. We have a summer camp that we're doing right now for the youth. But along with that, a lot of what we do is advocacy, because we firmly believe that, what we do, and at the micro level when we're working with individuals that walk into the office is equally as important as what we do to try to change policies and hearts and minds. So I'm sure I can go into more detail about what we do, but that's just it in a nutshell.
Excellent. Yeah, thank you both for all the great work that you're doing in the community. And we know that these last 18 months have not been easy. Immigrants have faced multiple crises over this time, including a pandemic that has harshly impacted immigrant communities. Can you tell us about how the pandemic has impacted your work with immigrants? And let's start with Monica.
Sure. So early on, we knew that it was going to look different for the folks that we service every day because we primarily service undocumented immigrants. And we knew that, they don't qualify for unemployment and the stimulus wasn't going to be for them. And so one of the first things we were able to identify was the need for food. And so we very quickly were able to pivot and become a food pantry. And then the other thing that we were able to do is we raised a lot of money because again, the folks that we serve don't qualify for the stimulus or unemployment. We created a kind of like our own stimulus. And we raised $1 million and we were able to provide many families. It wasn't as large as the stimulus that were given to us, but it was $700 per family to help them. And so we've been trying to come up with ways. Now we have a vaccine clinic at Casa. You can come and get your vaccine there. We also have a COVID testing site where you can get tested for COVID. And more recently, what we did was we started to get information and try to get it out to as many people as possible. And if we always complain that there's like zero resources in Pittsburgh, Pennsylvania, just imagine what it's like in the surrounding little cities and towns and counties over here. It's even worse. And so we've expanded our reach into different counties as well.
Great, thank you. Alfonso, how did the pandemic impact your work?
Well, basically, we were sent home on March 13 last year. And because what we do is education, and we usually have a building full of students, basically Monday through Saturday, particularly in the evenings. It was a little bit hectic to change our model or the way we used to work and serve those individuals. We basically don't provide what we call emergency assistance, like food baskets and vouchers for medication and bus passes and stuff like that. What we did, first of all, my team and I reconvened and we try to find a solution to this. So basically, we placed everything on Zoom, the platform, and where we start to meet, and we trained not only our volunteers to work on that, but also we did the heavy job to really connect with students and ask them if they have either a device to connect, like a laptop, a tablet, a smartphone. And we have basically to work with them one-on-one. Some of them were coming here. We launched Zoom trainings in person in the building, but that was basically happened after June. But from March through June, it was a little bit hectic to continue the services we provide. Then we started to plan the vaccination clinics. We host vaccination clinics all this year, 2021, basically since the end of January. We started to launch the vaccinations here on site, and we basically vaccinate a lot of people in the Spanish-speaking community. We started with seniors over 70, and now we basically finished last month vaccinating kids that are over 12 years old. We will retake that very soon, and we're still planning on doing that. Everything that we do, we move it to a different platform. We were able to get laptops to continue working from home remotely. We got Google numbers for the staff to communicate with the students. We were sent home because in a sense, we were shut down, and it was not good for the community we serve. Colorado was very strict on the regulations that we have. The governor was speaking loud and clear about it. So we were sent home and we were working remotely, and it helped us to improve a lot of our processes, and we're happy we did that.
Yeah, thank you for sharing and about that. And I just had a follow-up question for both of you. So you described some of the programs that you have to design in order to meet the needs of the community at the time. But what challenges did you face when coming up and providing with these services? What kind of sort of issues did you face, and how did you overcome those? Monica?
Technology. It was one of the hardest things for us, not only, so I would say technology, just because a lot of folks that we serve don't have access to internet, don't know how to use, we bought 50 laptops for our youth, and because we wanted to continue our programming in people's homes. A lot of kids were still in school, and they didn't have, unfortunately, Comcast that was giving the internet at a very reduced price. No one there speaks Spanish. And so it was very difficult for our families to get access to that. And so we struggled a bit. And there were some families that just couldn't have access. And we are still paying we bought them a hotspot, and we pay every month for them to have that service. And then the other thing that we really struggled with was access to information. Again, the Latino population is very small here, but that doesn't mean that we don't need the information. And it took a long time, over a year, for us to get even one thing in Spanish for our community. And so a lot of our staff worked really hard to gather information from other parts of the country and to tailor it to what needed to be done here. And even though we did all of that work, we're just one small organization. And, we only have access to X amount of people. So, I think that there was a big failure actually in our government that, didn't give us what we needed, because then people didn't understand what COVID was, and they weren't taking it seriously. And people were getting it, at a higher rate in our community.
Absolutely. Alfonso.
I want to say the lack of information as well, all across, for services, for emergency assistance, offices shut down all over in the state, schools and kids sent home. Actually, many parents has to stay working because in Colorado, construction never stopped, never. I mean, people went out to work, and people that works in hospitality, restaurants, and cleaning and stuff like that, mostly women have to stay home, or they were pushed to stay home because of their kids. But the husbands have to go out, but many families and women or parents like single parents were struggling with that situation. So information, also the lack of technology understanding. People have smartphones and they don't know how to download an app sometimes, or how to really utilize Zoom, particularly for students. That's why we have to hold hands and go one-on-one and train them into basically work on how to connect to our classes and stuff like that. So that was one of the bigger challenges we have with our legal clinics. And the tax preparations last year, it was a big fail. People were expecting to get our support for the tax aid with the tax aid program, and we were not able to do it just because ARP and the IRS were having very strict they were basically sent home because they did not plan on these, were not able to launch the program as we did this year, that we revamped it in a very different way, and we succeed. But it was very challenging.
Absolutely, I can imagine. And I want to step here for a second and just provide a reminder to our participants that at any point during the session, you can submit your questions to the panelists. Just click the Q&A box at the bottom of your Zoom window and type in your question. We, as mentioned during our presentation, the Trump administration also implemented migration policies. And how did these policies affect your programs and affect the people that you serve? Monica, let me start with you.
I think all of the policies that he implemented were really detrimental to the people that we serve because it kept people living in fear. And so right now, even for people to get the COVID vaccine, because of the public charge rule, which has really nothing to do with the vaccine, people are afraid to get it because they think that they can get deported if they simply get the COVID vaccine. So, keeping people living in fear is what has really harmed our community. And then, just keeping that narrative, because anybody that would listen to him, him saying that immigrants are bad and, they're undeserving and they're, less than us, really, that narrative really comes into people's lives and the way that they treat each other and people that are different from one another. So all of the things, whether it was policy or even just language, was just very, very harmful to our community.
Thank you. Alfonso, what are your thoughts about that? How did the policies implemented by the Trump administration affect your program and the immigrants that you serve?
Monica just said it well. Fear is one of those big factors in the community. The policy of the social charge, but thanks be to God, we have a great relationship with 4 consulates here in the Denver metro area. The Mexican, the Peruvian, the Guatemalan, and Salvadorian consulate are here in town in Denver. And because of that, our auxiliary bishop, Bishop Rodriguez, and Centro San Juan Diego, and the 4 consulate launched 5 different town hall meetings throughout the territory of the Archdiocese. And they were driving and moving along the northern part of the state with the territory of the Archdiocese. And basically they were providing information to people not to be afraid and what it means for them, particularly undocumented people, to be here, to be safe, to stay in the country, and how these policies will really work. A group of lawyers were part of these panels, of these groups on the town hall meetings, and that really helped the community. We basically try to educate the community because there was a lot of crisis as soon as it was announced that Trump was to be the next president of the United States. So there were people in a state of shock, in a state of fear, families crying and planning to move. Lots of people in Colorado moved back to their homelands, particularly to Mexico, because they see no hope on that. But in another hand, our citizenship classes skyrocketed. We have classes over classes, people coming over just to become a citizen during the Trump administration, and they push forward to get that done because they were afraid of losing their status. So we work really well with that. Now with the new administration, now basically the status is totally different. It's a big sense of hope and relief. And now our GED classes are all overfilled, and people still coming like crazy just because reopening of DACA, and that's great for the community.
Absolutely. And now that's a great segue actually into our next question, which is forward-looking. How hopefully we're nearing the end of the pandemic. What are some lessons that you will take into a post-COVID world? Monica, would you like to start?
Sure. I mean, definitely rethinking the way that we do things moving forward. I feel that, we were really able to do a lot of outreach into other communities that we didn't do before. And I don't want to take that as a one-time thing. I really would like to continue to do that work. And just, thinking about the way that we do things at Casa, we are very fortunate that we were able to pivot and quickly, see what the needs are and focus on those things without losing sight of why we are there. From the day that, people were ordered to stay home, anybody that needed services could call. Instead of walking through the door, they could just call, and they were taken care of in just the same manner as if they were to come in. And I think that the other thing is that, again, we are so proud of the work that we do on a daily basis with every individual that we get to service, but also the importance of advocacy, both at the state and the national level, because these people should not have been left behind, and they were done so, and it was intentional.
Great. Yeah, those are great lessons to take into the future. Alfonso, what are some lessons that you're going to take into post-COVID world?
Well, basically not take anything for granted, I mean, our life or daily work or ministry, but definitely be open to reconvene and replan and relaunch whatever we're doing. As Monica mentioned, we will as well quickly get together and rethink and replan and revamp programs, our website, because that was needed at that time. It brought stress, it was pressure, it was bringing pressure and stress in the team, but we were happy doing it. We all targeted trying to get this task done, and we were happy to do it. I mean, we changed our website for the people. Instead of coming and knock on the door, try to find all the information they might be able to look for in our website, links, resources, able to do pre-testing for the classes, registration, payment, emergency assistance, legal assistance through the website, everything. And phone calls, returning phone calls like crazy, because people were calling us and we have to be outside of the building. So, I mean, everybody of us have a corner at home that became our home office for months and months, and we were happy to do it. Like, definitely continue to work that way. That's the way we see we're going to continue, because we have improved our processes and services, and the retention rate of the programs we have is amazing now. It is great.
Absolutely. And actually, we have a question from the audience for Alfonso and Monica, which is related to what we've been talking about. Is there a service that you have created or that became virtual during COVID-19 that which you anticipate will continue to be in high demand over the next year? Go ahead, Alfonso.
I anticipate that one of the services that will continue is the family-oriented service of Diálogo entre Mamás, just because how practical it is for a woman staying at home, either during the morning or in the afternoons, to be able to connect and to talk to other women about their stress, their issues, their struggles with the kids staying home and stuff like that. So it became kind of like a support group, and we have opportunities for them to share, to learn, and to express themselves. That's one of the programs that I believe will definitely continue in the future. And definitely the services we provide that we used to have before will continue to be remote programs.
Excellent. Monica.
For us, definitely, we started a mental health program during the pandemic, and so that's actually growing more and more. So that's something we're going to keep. And we also started a new program which had to do with healthcare. So we hired somebody who's our healthcare navigator. One of the things that we learned is that the majority of the people that we serve don't have a doctor or have any form of preventative care. And so once we come out of the end of, providing vaccines and testing, we're going to definitely do a lot more work into helping people get preventative care. The food pantry, absolutely. I just think it's amazing. And, we're located in Beachview, and it is mainly where the concentration of Latinos live, but our white neighbors are there and they get to access our food pantry, which is really great to see. And then our forms of communication, how, we used to do things one way, and now we are definitely thinking about new ways to reach a larger audience, and we'll definitely take that into the future.
Fantastic. That's great. And we have already quite a few questions from the audience. So just a reminder to everyone, if you would like to submit another a question to our panelists, just use the Q&A feature at the bottom of your Zoom window. And this question is actually, I'll pose it to Dawn. In terms of collaboration, do you see corporate Catholicism, and that term is in quotes, as a barrier to improving assistance to immigrants and refugees? For some, the donation is made and it stops there. What's the next step that Catholics can take?
Yeah, I mean, I think the answer is a little tricky because, of course, you know, immigrants are Catholics at very high rates too, and they participate and they volunteer and they contribute quite significantly to Catholic institutions. That's our research shows that, the surveys show that. I think, I also think that just in general, Catholics are good volunteers. I'm thinking back on the early days of the Trump administration when there were real attacks actually all throughout the administration on the refugee program. And it was ultimately left fairly depleted. And there were lots and lots of people that were coming forward to try to do something for refugees. I mean, actually too many to accommodate given the low numbers that were coming into the country at that time and the low numbers that are still coming in. But there's a lot, I think there's a lot of goodwill out there. I'm sure that there's, you know, Catholics that give and that's it. What we're focused on a little bit though too is the Catholics that are, I mean, there's no two ways to put this. They're not with us on these issues, you know, and unfortunately, there's quite a few of them in the public sphere at this point, and I don't know, you know, kind of what their ideology is or what their touchstones are for the positions they're taking, but they're not Catholic touchstones, you know, and I feel that the same way with occasionally, you know, with certain Catholic press sources too. I mean, some of the most difficult interviews and some of the worst coverage you can get is from Catholic sources, and that's been going on for a long period of time right now. So I feel like we need to stop talking about a united church on these issues when in fact there really isn't. And when you talk like that, you kind of absolve yourself from responsibility for doing something about this problem. Catholics not approaching their co-religionists and the stranger is human beings and treating them with human dignity, and instead vilifying them and doing all those speaking of them negatively and supporting all sorts of negative policies. That needs to be addressed because it's a major problem for the church right now, and it's a major problem for our country.
Absolutely. Any thoughts about that, Alfonso and Monica? How can Catholics go, what's the next step after a donation is made to support fellow Catholic immigrants?
I think that we should really think about, like, if this is an issue that you really care about, you should really be doing something about it. Like, you know, so many times this has kind of been put on the back burner and like, oh, well, you know, I'm never going to talk to that really, you know, racist neighbor or person, you know, because I'm never going to change their mind. Well, you probably won't. But what you can do is stop them from saying things that aren't true. And so everybody here knows people that I don't. And just like I hear the things that aren't true, I know all of you do. And so just really stopping it. We have to stop it. Because just because somebody says something a lot and really loud doesn't mean that it's true. And I'm hoping that folks that are here are more involved in just this and have met people and know more and can tell stories, real life stories, and real things that they have learned, and just stop the rumors and stop this terrible narrative. We need help.
I would like to say that the next step should be just get involved. Come and see with your own eyes what your donation is doing, the impact of your donation, and how that support is really changing lives. That's what I would like to say. That that I feel that is the next step, because the closer they get to the job we do, they will know us better. They will get to know the people we serve with their support. I feel that this ministry, the ministry of welcoming the stranger, the welcoming the one that is new in the community, that is poor and that is different from the rest of the world, that is have a different color, have a different culture, have a different way of looking life, should be embraced and not study from far. Isn't the ministry we do is not like a petting zoo. You go and visit and say, oh, look at these poor immigrants, we will help them with food, we will help them with clothes. No, come and see there is one just like you. That's what I would like to say. Invite them to get involved. Our ministry should be supported not only by treasure, but as well with their talent and with their prayer. That's what we always ask from our supporters. We don't want just your money. We want you to come and see. We want you to get involved. We want you to pray with us and for the ministry we do, because that is needed as well.
Great, thank you for those responses. And we got it's more of a practical question for Alfonso and Monica. Do you have partners that assist with citizenship courses? And also, is the community wherever you work that is eligible registered to vote, or do you also do any work on get out the vote campaigns?
We do have partners that we work with that offer citizenship classes and that at times have pro bono attorneys that can help with that process. And we do a ton of get out the vote, and we do it everywhere. We do it often. We don't do it every 4 years. We do it at least once a year because it's really, really important.
We do partner with the field, with the USCIS field office that is located here in the Denver metro area. Usually the field director and some other staffers come to do a presentation in every single of our citizenship classes we have. They come themselves. They used to come in person, now they connect, and we have a great relationship with them. Our citizenship teachers, we have a 32-hour program right now. And basically we invite people to register if they qualify for to become a citizen, and they are our teachers and volunteers from the citizenship area. They are trained by them and by their programs, and yes, we partner with other agencies as well, particularly when people needs to fill up an application, waive their fees and stuff like that. Many of those things are launched to a network of collaborators as well. Excellent. And yes, the promotion for voting, I'm sorry, for the vote is part of the curriculum as well.
Fantastic. And another question from the audience. Now that the vaccine has become widely available in the United States, have you changed your services to accommodate people or other needs in this new phase of the pandemic?
It has become widely available, but not to our community. We have done things like taken mobile clinics out to different counties, out to farms. There's still a lot of work that needs to be done in our communities. And, you know, for us, it's not only making it available, but giving them the information that they need to make an informed decision on whether or not they want it. So we haven't pivoted from that yet. We're actually working really hard still to get people vaccinated.
Alfonso?
We have an issue in the community. A lot of the Spanish-speaking community do not want to receive the vaccination here in Colorado. There's a lot of hesitation on that. But in order to accommodate our programs, because we need to plan our 2021 in advance, we have planned to have all 2021 remotely. Right now, we are in the midst of planning the courses that will be in presence for 2022 on, but we definitely will continue, yes. And we did accommodations to have the computer literacy program on site, in person, with sanitizer, masks, and all the preparations to get those classes up and running in person here, even during the pandemic time. So everything went well. We have enough space here to have classes of 15 students at the time, plus the teacher in a big area, and it's still working fairly well. Yeah.
Excellent. Very good. And this next question, I'll pose it to Dawn. Does CMS have a way to support persons conducting follow-up research?
That's a good question. We sometimes are challenged in supporting our own research, I should say, you know, so we're happy to do this kind of research, and we always recognize that there's a need for more research, and we try to pull together researchers and academics and others that might be willing to study Catholic institutions and the people that they serve, because we think that the work there is so important and so good. But we don't really have a separate fund that allows us to fund independent research. We have to raise money ourselves for our own work. I would say, though, that we would encourage it. We have publications so that we could be a forum, provide, you know, a forum for publications on research that people do. We have our Journal on Migration and Human Security that kind of crosswalks the research community and the public policy community. And we can have forums like this to lift up important research. So we can support it, but we don't have a source of funding to do that.
And a reminder to our participants to send any questions if you have any for our panelists by using the Q&A chat or Q&A feature or the chat box. We're almost at the top of the hour, and I wanted to, we started touching about on this question, but how can the community, and this question I think it's for all panelists, how can the Catholic community at large support your work and support immigrants at this time? So Alfonso, Monica, Dawn, who would like to start? Alfonso?
As I said before, I feel like in order to support the immigrant community, we need to break the barriers, and we need to be open to welcome the one that is different. I feel that that's the only one. Create a space to welcome those that are different than us, even among ourselves. I'm an immigrant myself. I have the blessing to come to this country legally. I now went through the desert and run and no, but that's the experience of a lot of people have. And just because of that, many of the people in my community basically is stigmatized because they broke the law and they're illegally in the country. But the same people have them cleaning their houses and working on the restaurants or businesses and stuff like that. So just get closer, give yourself the opportunity, and among ourselves, let's be open and not be afraid. You know, sometimes we just tend to gravitate among the same circle because we feel fear. And we need to increase trusting in God, and that God will keep us and guide us and protect us. So be open and not to be afraid to speak the truth and to challenge those many times the comments and the ways we're looked at, you know. I feel like if we are open to start a conversation with others about current policy, about specific situations, we're going to start to change the policy and in their minds little by little.
I agree with you, Alfonso. The only thing I would add is that, to have those conversations, we have to educate ourselves. I bet everyone here knows how many stars and stripes are on the American flag, but do we know what role the United States has played in these other countries to make people have to migrate? And so we should know that information, and we need to learn it so that when we're talking to each other, talking to other people who may not have the same beliefs that we have, that they understand that. Because again, it is about putting yourself in uncomfortable situations to have uncomfortable conversations. If you really care about these immigrants, if you are saying that God has told you that you need to treat people in a different way than they're being treated right now, then it is your responsibility to get educated, your responsibility to get involved, and your responsibility to spread the word of truth.
It's certainly hard to follow those two. And I think that it's, I'm just so proud of Catholic institutions and Catholic leaders and listening to them and hearing about their terrific work and the people that they serve. I would say this from CMS's perspective. It is true that I think people that have encounters with this kind of work and with immigrant populations realize it's not an issue of doing for people. It's doing things with them. It's learning from them. It's kind of educating yourself, I guess. What we try to do is we try to do what we call person-centered work. That is, our research flows from the perspectives and the experience and encounters with immigrants and the people that serve them. And we're trying to create a body of evidence about immigrants, about immigration policy, and converting that into good policy ideas that we can bring forward. But never forgetting, although we do very serious kind of rigorous think tank work, that there's some values that underlie our work, like human dignity, human security, human rights. And I think that work is very important right now, because those aren't the values that animate a lot of people. And there's lots of disinformation and deliberately bad information in the immigration world, and policy proposals that are rooted in nothing really. So I think that the think tank work of the kind that we do is important at this point. But I think that the work that Monica and Alfonso and others are doing is extraordinarily important.
Thank you, Don. And on that note, I think we have time for maybe one or two more questions, but this question is for you, Don. Does CMS work with the U.S. Catholic, with bishops in the United States, and do all the dioceses have an office that works with immigrants?
Yes, we do. We don't work directly with the bishops in the sense that we're not affiliated with the Bishops' Conference, but we work with lots of bishops and participate in lots of processes with bishops. And so, yeah, I would say we have a cooperative and I hope a very supportive relationship with the bishops on these issues. I'm sorry, the second part of that was?
If every diocese has an office that works on migration.
Yeah, I mean, in every diocese, there's different ways to kind of address the needs and the realities of migration. There's ethnic apostolates, there's immigration programs within Catholic Charities, there's refugee resettlement programs, Catholic Charities provides all sorts of services, parishes provide all sorts of services. So I think in any diocese, you'd find lots and lots of offices that are addressing this reality in different ways.
Excellent. And I see we have a couple of other questions, but I think given the time, we're going to follow up with you via email. I want to thank once again our panelists, Alfonso Lara, Monica Ruiz-Caraballo, and of course, Don Kerwin, for joining us today, and everyone who has connected with us over this hour. Thank you for joining us, and we hope that you enjoy and continue to disseminate the report. And thank you for all the amazing work that you do every day for and with immigrants. So with that, we're concluding today's webinar, and have a great rest of your day.